My final question, I'll shoot to Dr. Aiesha first. Because this the nature of your cancer is a breast cancer, when you were diagnosed with it, did any point of time you felt like you were less of a woman?
Definitely, because it makes me feel less feminine. Breast is a feminine organ. So at a young age, when I was 21, and I was given this option of you want to get rid of your breast and increase your chance of survival, or you want to take a chance and just do chemo and everything. But of course, it's not a good option. So I think this is very, very important for me to highlight about the condition that I was diagnosed later on, which is a PTSD. So I developed post-traumatic stress disorder, and to be honest, I find that this diagnosis is embarrassing. I feel embarrassed to have a PTSD because I like to be in control of my emotion. I want to be able to regulate my emotions and know and to be calm, composed with all the bad situations that happen in my life. But the thing about PTSD, as I learned as having this mental issue is that it is beyond your conscious level. So you can't control it. It's your nervous system feeling threatened in order to protect you. But at the same time, it is so debilitating that in not being able to see the reality because of this survival mechanism. So I was shocked to find out that I have PTSD because it developed so much later. The thing is, I do not understand about depression. So I had cancer 2 times and I developed so many health issues along the way, and I do not develop depression and anxiety. But only later on, when I had my triggers and I had something inside my nervous system where I feel that the way I respond to things is amplified. So I have to have a change of direction in my life, and I have to build my career in a way that it matched with my the evolution of my story as a cancer patient. So one thing I would like to highlight here is I want all the doctors out there to understand that mental issues is almost some form of anxiety, depression is common among cancer patients, and they need to address the elephant in the room. So we can't just speak to the patient like about the treatment plan, all the textbooks, because we are human and we have emotions and we have all these worries and fears, and sometimes it can be beyond rational and people do not understand. So we have problem in terms of relationships, be it among our family members and friends. This is a tricky thing to navigate, not just me, not just my caregivers, because there's something that is a different language, you see. People do not know how to talk to you, and you do not know how to express yourself because you don't even know what's going on. I invested in a therapy session, so I did a hypnotherapy and I did counseling and also a psychoanalysis to help with my trauma. And I believe that is the most expensive investment after after my surgical expenses, and it is worth every penny.